Sculptra contains poly-L-lactic acid. PLLA, as it's known, is a potent collagen stimulator, known as a biostimulator. When injected into the skin, PLLA will regenerate new skin and new volume in the deeper tissues. Sculptra was first used over 10 years ago to help HIV patients in the NHS to restore volume, and since it's become a very popular cosmetic treatment to restore natural volume and improve skin quality and texture. What is the best age to start a Sculptra treatment? We usually see the aging process in the late 20s and early 30s, where there may be some subtle changes in volume loss and shape to the face. This can be a good time to start Sculptra treatments because very little treatment is needed. However, most of my patients are in their 40s and 50s, where there is established volume loss and often laxity of the facial tissues and a thinning of the skin. Sculptra is an ideal treatment to restore volume and to restore and improve this quality of the skin to give a very natural looking result. When you come for a consultation about Sculptra, I'll spend time with you to make sure you understand what Sculptra is, how it works and what the treatment involves. I'll do a thorough assessment of the facial aging as it's affecting you and can advise you onto the amount of Sculptra that you may need and how long the treatment course will take. When you come for treatment, we will apply some local anaesthetic to the skin, and the Sculptra, which is mixed with local anaesthetic and sterile water, is injected deep underneath the skin, and I use a cannula, which is a blunt tube. This means that the treatment is very safe and minimises the risk of any bruising. The number of treatments that you may need will vary between 1 and 3 in most cases, dependent on your age and the amount of volume that we need to regenerate and the improvement of the skin we need to have. As a rule of thumb, we normally say you'll need 1 vial of Sculptra per decade of life. And we usually spread that over between 2 or 3 treatments in most cases, usually a month apart. Sculptra is a natural biostimulator. It takes time for it to work. Usually following a treatment, you'll show the first signs of improvement 3 to 4 weeks later. But the best results are usually seen between 3 and 6 months following the Sculptra treatment, and it can continue for up to 9 months following Sculptra to get to the final result. The results with Sculptra are long lasting. Once you've achieved full correction, which as I've said can take up to 9 months, then the results will often last for at least 2 to 3 years, and in some cases 4 years or more. It's advisable to have top-ups along the way just to keep things as they are. It's usually maybe 1 treatment every 1 to 2 years is appropriate and will maintain the full benefits of the Sculptra course that you've had initially. Sculptra is a very, very safe treatment, and now we're using a blunt cannula to administer it. There are really no risks. In the past, Sculptra had been associated with the incidence of small temporary nodules or lumps under the skin. This is no longer the case. We know now that by diluting Sculptra much more, we can prevent this happening, and certainly this is something we don't see anymore. Sculptra is ideally combined with other treatments, especially treatments that lift the tissues, such as Silhouette Soft and other suture thread lifts. Obviously with Sculptra we can replace lost volume and we can improve the skin, but there may be some underlying laxity still present through the aging process. Polylactic acid is the constituent of Silhouette Soft, so it's compatible with Sculptra, and it's a treatment that I often combine, especially in those older patients in their 50s and 60s, where we can get a result similar to a facelift. Many of my discerning patients who are looking to achieve these results but don't want to have them straight away, such as with dermal fillers, are looking to Sculptra to get that slow but gradual and long-lasting natural result.